Hello, welcome, doctor. Thank you for joining us for a Mishti podcast. We're very excited to have you. Before we get started, if you don't mind just doing a very quick, brief introduction for yourself and your specialization, that'd be fantastic.
I'm Dr. Raghvendra Rao. I'm a specialist in orthopedics, mainly subspecializing in the specialty of spine surgery.
Okay.
For the past 15 years. Patients with all sorts of spinal problems. I've had my training both in Bangalore and in France.
Okay.
And after that, I've settled here in Bangalore and I'm working for the past probably 14 years here.
Okay. Excellent. So you are basically a bones expert. Spine definitely, and everything to do with bones and skeletal issues. Excellent. So maybe I'll start with the very first question. This podcast is focused on senior citizens. I'll ask you, what are the typical issues you tend to see with seniors and skeletal issues?
See, basically, by elderly you mean the retired people.
Correct.
Those
60 plus.
60 plus.
Mm-hmm.
So those are the people who have broadly three types of problems. One is the joint wear and tear problems, like joint pains, knee pain, hip pain, or the joints of the hands.
Mm.
So which limit their usage of their joints, mobility.
Right.
And then the foot pain or tendon pain in the foot or the ankle.
Yeah.
That is one category. The second category is midline pain, like in the neck pain or back pain.
Right.
That can be quite disabling or lead to decreased quality of life.
Right.
Because everyone has a back pain or neck pain once or twice in their life. But when it becomes a chronic issue, that can cause decreased mobility.
Right.
And as we know, mobility is life.
Correct.
So if we don't have mobility in our life, it leads to a lot of problems.
Right.
Which is mainly osteoporosis.
Right.
So osteoporosis is nothing but the decrease of bone calcium. It's not the decrease of blood calcium. Blood calcium will be normal.
Right.
If you think, you can think of bone as a bank,
right,
which takes calcium and gives back calcium to the blood depending on the need for it.
Right.
So the bone is not able to hold on to the calcium that gets.
I
that
see.
Means the bank is going bankrupt.
Correct.
And then it becomes weak. So what is supposed to be like a brick becomes like chalk, very soft.
And starts to fracture.
And starts to fracture. The main fractures are happening in the spine, the hip, and in the wrist.
Okay.
It does not require a fall at all.
Really?
Actually, more often than not, they have a fracture. And because the fracture is completed over a period of time with small microfractures, they fall because of the fracture. It's like
they don't recognize they have a microfracture.
Yeah, no, they recognize they have a fracture, but they don't recognize that they have a microfracture.
Right.
By the time they fall, they would have had a complete fracture. Usually, what we see is a fall causing a fracture. Many a times, it's a fracture causing a fall. All said and done, this leads to decreased mobility.
Right.
Which can actually impair the whole quality of life.
Absolutely.
Once there is decreased in mobility and they become bedridden, they face all the problems of bedridden people.
Of course.
Lung infections, urinary tract infections, bed
sores.
Again, the rest afforded by being bedridden leads to further osteoporosis. So to prevent osteoporosis, one of the most important things they have to do is be active.
Right.
They are not able to be active because of all these issues.
Right.
So whenever they have these sort of pains and niggles here and there, it's better to get it evaluated rather than be scared and wishing it away.
Right. Yeah. Right. And so you mentioned two. The third one I'm not sure. So you mentioned joints pains. That's typical. So mid structure. So
and osteoporosis.
And osteoporosis is the third one. Understood. So when they do have prolonged or chronic pain, or they tend to experience the same pain over a period of time, it's a good idea to go get it checked, just so it doesn't become a bigger issue.
Yes.
And that's very wonderful.
Ignorance is fear.
Yes.
Knowledge is.
It can cure you.
You get really brave with knowledge.
Yeah, that's true.
And you don't get scared when you know the know-how of things.
Yeah.
Isn't it?
Absolutely.
So the more you are ignorant about, the more you think about all the worst possible things and get scared.
Right.
And then that leads to further ignorance.
So it's better to just get your information and make an informed decision.
From the right person and get it, yeah.
Absolutely. And that's where Mishti comes in. We are trying to bring in the right people into the mix to make sure that you get the right access to information at the right time and through trusted people. Another question I wanted to ask you, India seems to be one of the leading capitals of the world when it comes to knee replacements. Is there some sort of a driving phenomena? Are we genetically more predisposed to weaker knees?
See, I can attribute two factors for that.
Yeah.
One, the longer life expectancy.
Right.
Two, the advent of the nuclear families. Where, see, in the previous eras, there used to be a joint family with 20 people.
Right.
There used to be some grandchild here or there, someone here or there who would take care of the elderly.
Right.
So the dependence is less now on the family. They want to be independent till the last day.
Right.
You have to go to the market, you have to get your things, you have to get your house sorted out. More often than not, you especially should know, NRI parents are often a couple in home.
That's right.
So they need to be independent, capable of doing all their activities.
True.
So they can't do that if they have a disabling knee pain.
Correct.
So they go in for the knee replacement.
I see.
Which is actually one of the most successful orthopedic surgeries. It's one of the most successful interventions after your coronary artery bypass graft or coronary angioplasty.
Right.
Because it changes the lifestyle drastically.
Understood.
For the better.
For the better. Is there a particular age that you recommend that they consider, or is it just purely symptomatic? If people
ideally, age comes as a question only because the life of the knee joint is a certain specific period.
What is that? What is the life joint?
No knee is as lasting as one God has given us.
I see.
Okay? These are all mechanical knees, made out of chrome, or cobalt chrome, or titanium, whatever.
Right.
And they all have a wear and tear, which is faster than the human joint wear and tear.
Interesting.
So they have to be revised after 15 or 20 years.
I see.
What I mean to say, if you implant a knee at around 65 years of age, by 75, 80, 85, the patient has to be re-implanted with a new set of knees.
Right.
So if you do that procedure at 50, it is all probable that in his or her age, he would have had two revisions. One at 70, 75, one at 85, 90. Because the life expectancy is more.
Gone up.
So the ideal age would be 60, 65 plus. But then that is not the criteria for choosing a knee replacement.
Right.
The criteria for choosing a knee replacement are different.
What is that?
It's a decision driven by the patient. It's not a decision driven by the doctor.
Okay.
For example, if you have a worn out heart, what I mean, a blocked vessel in your heart, or a worn out kidney, you don't have a choice. It's a life threatening condition. Absolutely. The doctor prescribes the surgery for you, you have to get it done.
Right.
But the knee joint issues are not like that.
Right.
All the orthopedic wear and tear issues are not like that. They don't harm your life, but they harm the quality of your life.
Right.
So they make you less independent and more dependent on aids.
Got it.
So it is something which the patient chooses if he or she feels that this is quite disabling and affecting the functional quality of life.
I see.
It is only given as an option in the menu of treatments. Like for example, physiotherapy is the first step, exercises, some plain simple analgesics like painkillers, and hot fomentation, gel, sometimes an injection around the joint to relieve the pain. Those are all options given to the patient. Along with that option, surgery is also an option. By option, I mean it is not mandatory for the patient to get it operated like in another condition like the heart or something similar. But here, it is an option taken by the patient. So if you say that India has a drive towards total knee replacement, you can actually indirectly tell India has a drive towards becoming more independent
and independent. Understood. And speaking of wear and tear natural wear and tear of human knee, what are some things that people can do to improve their joint conditions? Is it too late if you already have pain? Can it be reversed? Is there anything one can do?
Wear and tear is an irreversible process.
Right.
But having said that, it's a function of age.
Right.
So whether you use your joint or not, with age it degenerates.
Okay.
But then the rate of degeneration is more in certain types of conditions. Like for example, smoking, sedentary lifestyle, repetitive forceful activities of deep flexion, that is bending the knee completely after a certain age.
Okay.
And certain other conditions which affect the bone. Those are all secondary causes. But primarily it is a function of age and usage.
Right.
But having said that, once you start having these degenerative changes, it is better to avoid certain positions like complete bending of the knee.
Like when you squat. Squat. Right.
And repetitive steps, climbing the stairs and descending the stairs. That also can be avoided.
Okay.
To slow down the progression of degeneration.
Understood. I know of quite a few seniors who like to go for like hiking, climbing up.
There is no restriction.
Right.
It is just that they need to be aware that is something which can cause.
Right.
In fact, there are some seniors who go for small hikes or treks even with the knee joint replacement done.
Right.
Because it restores them back to their life. That's the whole point of the surgery.
Exactly. Right? Yeah. And that's absolutely safe. There's no issue around that. Understood. One other question I had very quickly on spine is that I see a lot of seniors starting to slouch with their spine and over time become progressively bent. What causes that, and how does one avoid that?
See, basically there are two causes for that. One is any disturbance in the musculature of the spine.
Mm-hmm.
Like for example, the power of the muscles of the spine to hold the spine erect.
Right.
When they start losing that, they slouch.
Okay.
The other thing is when they start having a decrease in the height of the bones. Like for example, in osteoporosis.
Right.
So the big like bone actually starts to bend forward. Then they start becoming hunched.
Right.
So apart from that, there are many other causes like ankylosing spondylitis or kyphosis caused due to neuromuscular conditions. But then basically these are the two. Either the muscle fails to hold the spine erect, or the bone just starts to crumble forward and they become slouched.
Naturally start to slouch. What can one eat? Is there any dietary recommendations to help get your bones stronger? It used to be milk when I was younger. Is it still
even
milk?
today it's milk. The thing is, you need to have adequate calcium in your diet.
Okay.
Up to 60, or let's put it this way, up to menopause in ladies and up to around 70-75 in gents. Okay. Dietary calcium is enough. Okay. You don't need to take extra supplements of calcium unless and until you are lactating or pregnant. Right. But beyond that, beyond menopause and beyond 70-75 in adults, you can, beyond menopause in ladies and beyond 70-75 in males, you can have supplemental calcium. Okay. And vitamin D also, based on your vitamin D levels. Right. So both these will help in maintaining the bone calcium. Okay. In spite of this, there is a chance that because of the lack of hormonal support in menopausal women, the bone calcium gets depleted and they end up having osteoporosis. Okay. For that, there are special medications now which can be prescribed after adequate tests are done.
So, doctor, another common ask is, or at least a common concern I've heard from seniors, is their concern and sort of scare around surgeries, particularly anything to do with their spine. They would never touch it. Yes, anything you want to say to that?
No, we have all come across patients who are scared of surgery, and more specifically spine surgery, because there is a myth that spine surgery is very morbid. Causes a lot of problems.
It's binary, basically.
Yes. You either come out of it or you don't come out of it. That's the sort of feeling people have. Till now, I've never seen a patient who comes walking into the clinic saying, I need a surgery.
Excitedly.
No, most of them are scared.
Right.
They are scared because of two reasons. One, they are scared that it will make them bedridden. And the second thing, they are scared that at this age, can I tolerate such a procedure? Withstand such a procedure? First thing, they are scared that they are bedridden. The rate of complications of paralysis or nerve injuries during spine surgery is very less. Okay. It's actually, if you compare it across the spectrum, it's less than 1%. Okay. Maybe in some areas we have a risk of having a road traffic accident more than that. Right. Don't we travel on the road? Yes. Having said that, the field of spine surgery and surgery in general has advanced technically so much in the last 2 decades that it has made spine surgery safe. Right. Most of our patients walk on the same evening of surgery. Wow. Wow. Even scoliosis and kyphosis, spinal deformity surgeries, where we operate in young kids, 12, 13-year-old, from the top of the spine to the bottom of the spine, putting in 20, 25 screws. Wow. They also walk on the same evening. They take a few steps. That's incredible. The moment they get to know that this is possible, brings about a great deal of confidence in them. Right. Okay? Absolutely. And they go home in 3 to 4 days. ICU requirement is minimal. And the second thing is, there are so many gadgets now which have made spine surgery more precise, more accurate. Right. So this has led to a lot of improvement in the complication rates. Absolutely. That means they have made it less. And also combined with the fact that there is a need to be self-reliant. Yes. There is the need to do physical activities like walking. For example, in diabetics, you can't avoid walking. Yeah. So if they don't walk, they put on more sugars and they put on more weight, which leads to actually more pain. Absolutely. So all this has made spine surgery a much more thinkable and feasible option. Right. Everyone is scared of it. They're also scared for the fact that at this age, can I tolerate 80, 85? But you're seeing patients of that age, and it's absolutely... The highest, the oldest patient we have operated is 97 years. Oh. And he walked on the same day. Amazing. Amazing. So you will be surprised to know that these problems are more common in the elderly. Yeah. It's not like it comes in you or me who are in their 40s. Yeah. No. it comes only after the 60s.
Right.
And there is a need to be active more in the 60s.
Absolutely. Yeah.
And India being a country where diabetes and hypertension are so common,
Yeah.
two out of three of our elderly patients have more than one or two risk factors.
Yes.
Added to that, you take thyroid, asthma, everything makes it a nice khichdi of problems.
True.
Okay.
True.
But at the same time, the medications for these specific disorders,
Yeah.
the anesthetic care,
Yeah.
the intensive care
Yeah.
have all improved so much that they have made spine surgery a safe and feasible option.
Absolutely.
So there is no need to be scared of the surgery.
Yeah.
Of course, all this will come to light only after a proper evaluation.
Absolutely.
So evaluation will be possible only if you step out of your house and of your mind
Yeah.
towards a doctor or towards a hospital.
Absolutely.
Isn't it?
Yeah. And I think just to close off the podcast, Doctor, one of the questions that come in is people are afraid to ask questions to doctors. What would you recommend to seniors if they come to you, for example?
We've always maintained that there are no silly questions in healthcare.
It's your health after
There are
all.
only silly answers.
Yeah.
The questions are never silly.
Right.
So a patient has a right to know everything about the problem and the proposed treatment.
Right.
So if they have any questions, they should be forthright.
Yeah.
And we have been providing quite a adequate time to
frame
the questions and answer the questions.
Yeah.
They can come back to the doctor with a written sheet of questions and one by one ask.
Wonderful.
Typically, a surgery counseling or counseling of a spine patient takes around 30 to 35 minutes.
Right.
So they can take benefit of that.
Okay. So it's good to have, and so one of the things we're trying to do with this podcast is get people very comfortable. When you go to a doctor, don't be afraid of doctors. Find a good doctor. Feel very comfortable to ask questions, and it is your right to ask questions. And as you mentioned, Doctor, you would take the time to explain how and why. And
most of the doctors would take time to explain. It's only a few who don't. So,
and that's a good way for you to know whether you want to go ahead. No, thank you so much, Doctor. This was very, very informative. Really appreciate your time.
My pleasure. Thank you.